everybody, this is Dr. Ariel Ross. Today's tutorial, or I should say mini workshop, is going to be all about breath work and the relationship of the diaphragm to the rest of the body. So, a lot of times when I'm treating people who have low back pain, they come in and they have really flared out rib cages which are stuck in the inhale position. So your ribs sit all throughout here and go down to your back. And a lot of people, because of stress and just other things, comorbidities, asthma, a lot of people have their rib cage in this flared out position, which creates a little bit of extra extension at the lumbar spine. So a lot of work I do with my low back patients is to help them try to take deeper exhale breaths to try to create a more neutral position of the rib cage stacked over the pelvis. A lot of the musculature in the low back is, deep towards the spine. So when it comes to breath work, you're accessing a little bit more space and by stretching the diaphragm, which is a muscle, it's the main muscle you use when you breathe, you're actually helping create a little bit more space and just a more even pressure system inside of the center of your body. So it's always something I check and look for people who are having any type of back pain, and usually it helps them with stress reduction and their pain levels because those can go hand in hand. So first things, what you're going to need for this workshop, you'll need a space on the ground. It doesn't necessarily have to be a yoga mat, but just a space on the ground where you feel comfortable. And then you will need some type of band, or you can use a tight belt, but something with a little bit of give so that you can feel resistance, but you can also feel the ability to move and stretch through the band. So if you have a belt that has elastic on it, that's perfect. If you have a resistance band that's looped, that's fine. If you don't, no worries. You can also just use a towel draped across your body. You'll get some of the effects, but not quite the exact same. But it'll still be worth it. So the first thing I'm going to show you how to put the resistance band on. So you're going to put the resistance band over your body and you're going to try to take it to where you feel your ribs sticking out. So a lot of people I see also breathe through their chest instead of breathing through their lower lobes of their lungs. So that also can create a lot of stuckness around that lower abdominal area, around your digestive tract, around your low back. So it doesn't have to be perfect. These bands kind of roll up sometimes, but you want to put that band right across your ribs, and you might already, from putting that on, start to feel this downward pull on the ribs. That's exactly what I want you to feel. Next thing, I always start people breathing on their backs. It's the easiest place to try to get that 360-degree breath. So before we go down, I just want to show you that this band is going to go all the way across our body. That's because the breath should be a 360-degree breath. It's not just in the belly, it's all the way around to the sides and in the back of our rib cage. So you want to see all of that moving or pressing into the band. So go ahead and come down to the floor and adjust your band if it rolled up a little bit. And again, you're trying to place it at that area where you feel like your ribs are kind of humped up. So you can see me, I have a really big lumbar lordosis. So that arch in my back, I have extra arch. So in order to help mitigate that, I'm going to pull in through my core and do a little bit of a posterior pelvic tilt to flatten my back against the mat. So I'm going to repeat that again just so you guys can see it. I was here first with this big space under my low back, and what I did is I took my pelvis like a bowl and tipped it back towards my rib cage, trying to flatten out that back area. Okay, so once you're in that more neutral position, you can have your back lifted slightly, but you just don't want to be excessively arched or excessively tilted under. Kind of find a happy medium place. And then I want you to close your eyes and take a couple breaths how you normally breathe. Notice where your breath is. Do Do you feel the breath around the band? Do you feel the breath around your chest, above the band? Or maybe you feel your breath in your lower abdominals, below the band. And with every inhale, you're going to feel just a really subtle rocking. The ribcage tilts up and then down. Place your hands on the sides of your ribcage. And notice here if one hand is expanding more than the other. For me, my left side expands a little bit more than my right side, and it just so happens that my right side is tighter. So starting to draw some of those correlations in your body. Then take your hands to your low back on your sides here. And again, notice where your breath is. Is your breath more on one side compared to the other? Deep breath in through the nose. Deep breath out. So now we're going to get a little bit more into how to improve those differences in sides. So make sure your band again is at that kind of rib hump position. It's where your ribs are a little bit more prominent here. And then you're going to take your hands to the sides of your rib cage, and you're going to take your index fingers right on top of your ribs, your upper ribs here, right below your breast tissue. You'll feel the ribs right there. So you're going to take a deep breath in, and on your exhale, you're going to try to press down and in on your rib cage. So your hands are going to be moving in this direction. Giving yourself a little bit of a tactile feedback. Maybe you'll feel your back flatten here, and then relax. Take a breath in, and an exhale, giving the ribs a little bit of a push down and in. Breath in, and breath out. Maybe a little shimmy if you feel like it's stuck or you're not just with that movement. Breath in, breath out. And keep practicing this. Inhale and exhale. One more breath in and breath out. Relax your hands by your sides. Stay on your back. So I'm going to show you here in a different angle, just if you weren't quite getting that. So in seated position, the band is still at that rib hump, which is also, it's giving you that same cue that you want your hands to help with as well. So as you inhale, the ribs move up and out, and as you exhale, you're going to try to round your ribs down and in. You'll feel your core contract. Inhale and exhale. Inhale, breathe into the band, front, back, and sides. And exhale. Try to move your ribs in and down away from the band. So, I hope that this breathwork technique helps you with some back tightness or just noticing what side of your body is getting a little bit more air. Air helps move oxygen, so it's really vital to help healing, to help just regular, functioning of your organs, of your muscles. All of your systems need oxygen. So if you noticed a place where you were a little bit tighter with your breath, see if that correlates with shoulder tightness on that side, or low back pain on that side, or hip flexor tightness on that side. And then you can start to kind of piece together how the diaphragm is really a crucial piece when it comes to some of our, aches and pains that we feel in the body. I hope you all enjoyed this quick mini workshop, and I hope you join me back here again. Always remember that you're your true teacher. You know more about your body than anybody else on this planet does. So listen to that voice inside, that voice of your body, and do what it needs today. Have a lovely rest of your day. Until I see you again, peace.